The PROSPER study in prostate cancer was a large randomized phase 3 study looking at patients with what we call non-metastatic castrate-resistant prostate cancer, or M0 prostate cancer. These are patients that on bone scan and CT scan have no evidence of disease, and yet their PSA is rising. In fact, it's rising quickly. PSAs had to be doubling in less than 10 months, and on average they were doubling around 6 months or less going into this study. So these are patients with rapidly rising PSAs and yet no evidence of metastatic disease. Most of these patients had either prostatectomy or radiation therapy. We know there's microscopic disease somewhere, we just can't see it. And so using drugs like enzalutamide makes sense. This was a randomized study of placebo versus enzalutamide looking at the time to metastasis or metastasis-free survival as a primary endpoint. And the study was dramatically positive. It showed about a 2-year improvement in the time to median metastasis in the two arms. So it was about 14 months median time to metastasis in the placebo arm and almost 3 years in the or 39 months in the enzalutamide arm. And what was really remarkable was this delay in metastasis was also associated with a dramatic PSA control rate about the same time. So we saw patients' PSAs decline with enzalutamide and stay down for that whole time. Patients tolerated the drug pretty well. The side effect profile was similar to what we saw with enzalutamide in the metastatic castrate-resistant setting, even though these patients were on drug for a longer period of time. But we do see a small incidence of falls, of dizziness, of fatigue, and other side effects. And so there's a balance between the use of this drug in this setting for those patients who we think are going to live long enough to benefit by delaying those metastases, and those that might be susceptible to the symptoms associated with this drug and complications from them. So the average age on this study was 74. These were older patients, and yet most of these patients tolerated the drug well.